So today's question came from Ahmad Rufai, and he's complaining, please, what is the main causes of gums bleeding, especially in the morning and during while brushing the teeth? Okay, first of all, let's see how the structure of the teeth is. Let's draw one tooth. So, assuming this is the structure of one tooth, so the causes of this bleeding, especially in the morning or during brushing of the teeth, can be due to different reasons. Just assume this is what we call the gums. It has its own covering. We call it the gingival epithelium, and it has its own connective tissue, which has blood vessels and nerves supply and other things. This is the tooth. I'm assuming this is the enamel, the dentine, the pulp cavity, the periodontal ligaments, and the cementum, the alveolar bone, and the rest. So these causes of bleeding can be as a result of accumulation of bacteria. Bacteria can accumulate here on the tooth. This bacterial accumulation is what we call the plaque. Before you know, this plaque can start to create problem here. Create problem on the surface of the gums. So when it creates problem on the surface of the gums, our body will try to react in a process we call inflammation. So when this gingiva, which we call the gums, the covering of the gum, get inflammation, we call it gingivitis. And this gingivitis, any slight mistake, it can lead to bleeding, because during inflammation, the cardinal side of inflammation will have swelling, and swelling and redness, it attracts histamine are released by some of these chemicals, some of these body immune cells, which attract red blood cells, a very high amount of red blood cells there. So any slight cut of this during this gingivitis, it will lead to bleeding. And also, when this bacteria goes deep into other gum structures, which can even affect the cementum and the periodontal ligament, in such case we call it periodontitis. And periodontitis can also lead to bleeding, especially in the morning, any trauma to the tooth. And also there are some drugs that we take. Some of these drugs are blood thinners. Like they thin our blood. Some are anticoagulants. They prevent clotting, and some are antiplatelet. So the usage of these drugs can also lead to bleeding of these gums. And also in pregnancy. In pregnancy, there are hormonal changes that happen in the system of the pregnant woman. And such changes can affect the gingival integrity and can lead to bleeding while you're brushing it or any other thing. And flossing. When you are doing improper flossing, after you eat food, after you do this, you can create trauma around the edge of this tooth. That is where the tooth meets with the gum. You can create trauma there, and it will be leading to bleeding. And improper uses of dentures. These dentures are like fittings to the tooth. When they are not your size, they are improperly. They are not fit. They are not fit in your feet. So before you know, it can be created like a micro trauma, and can result to bleeding. And also we have trauma. When someone gives you a blow on the tooth, or where you fall down, or any other trauma, can also lead to this bleeding of the tooth. And there are other deficiency diseases like deficiency of vitamin K, or deficiency of vitamin K, or deficiency of vitamin C, which we call like the scurvy. So scurvy can also reduces the integrity of these gums and can lead to bleeding at any point in time. And also, assuming this is your brush, the brush you are using. You see, in this case, they are evenly, they have the same height. But what if it is a worn out brush, like this? Some places are like this, while some places are like this, while some places are like this, while some. So if you are using this type of brush, as you are brushing the teeth, you will be creating trauma, because some are taller than others. You will be pressing them on these gum areas, and that will be creating trauma as you are using one out tooth. So from this, you definitely know when you're having bleeding during, like in the morning or while you are brushing your teeth. Definitely you need to go and see a doctor in the hospital. So thank you.